United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Doreen, could you do the roll call, please?
1 second, I'm sorry. Thank you for listening. Sorry about that.
Okay.
Amo, Anagnostakis,
Present.
Ellers.
Here.
Fagion.
Here.
Luhan.
Present.
Sutherland. Here. Patel. Here. Chili.
Here.
7 present, 1 absent.
Great, thank you, Doreen.
You're welcome.
All right, first up, we have Darcy Miller, Commissioner of Social Services and Mental Health, for your monthly update.
Good afternoon.
Hello again.
Thank you. Hi again. Okay, so highlights. The budget passed. I think some very positive things in the budget for the mental hygiene system. Just put a few in here for you as they all get tweezed out as we go forward. One of the things that we're very pleased about is the COLA, the 5.4%, and the stipend. I included a quick chart here for you. We have the lower rates, lower Medicaid rates here in Orange County due to cost of living, and having those rates increase help support the increase in rent, obviously, for people who are living in community residence and or supportive apartment, which means they are billable Medicaid services that have enhanced supports around them for people who have serious mental illness who are living in those settings. The second chart is for supported housing rates. We have about 320 supported apartments throughout the county. That's a stipended rent with housing case management support for people who also have serious mental illness but are able to maintain greater independence with their functioning level. And that stipend and COLA amount will also help us to better provide support for those increased rents. We never had any vacancies in those programs. We always have a waiting list, but we have a waiting list and vacancies because we can't find apartments for the amount of money that we have available to find them. So back to the conversation we just had at the last meeting.
Yes.
The 730 comprehensive restoration reform did not pass. We're a bit disappointed by that. We used to pay 50% of the cost of restoration, and that's for people who have felony charges, who have had a competency evaluation, who have been found incompetent by the court, and then are sent to the state hospital here, Mid-Hudson, for restoration. And we used to pay 50% of that cost. We now pay 100% of that cost, plus the daily rate went up from $750 a day to over $1,000 a day at the same time that we took over, paying 100% of that cost. So it's a very expensive item in our budget, well over $1 million this past year. Increased state aid funding for substance use. We're waiting to see how that's all going to come out. Medication-assisted treatment in county jails becomes mandatory in July for those who are challenged with opioid addiction. We received $170,000 from the Department of Mental Health, and we're currently working to pass through that money over to corrections so that they can have WellPath, their contracted provider, have those funds to help cover some of the cost. I'll be very curious to see how many of those inmates at the jail are eligible and will benefit from this service. The population has changed, as we all know, under bail reform.
And what are they doing now? Is there a program for them?
Currently, no. Currently, they do detox as appropriate, and they do continue methadone, for example, for pregnant females who come in. And we have a program to do Vivitrol for those who are exiting the jail. So Vivitrol is a shot that lasts for 28 days that covers your receptors, so it prevents you from getting high. It's a very dangerous time for those who are addicted once they're released from jail. If they use, as they have previously used, to going to jail, the chances of overdosing and that being fatal are much higher. So this is moving forward across the state. It's been activists have supported this effort for a number of years so that people who go into jail who are addicted to opioids will have an opportunity for best practice recovery options while they're in jail.
Great.
The 5.4% COLA passed. We're excited by that. I believe it's already been included in our state funding letters and will go out to our community providers who receive those funds and also may benefit for state funding we have within the department as well. They did increase the 988 Crisis Prevention and Behavioral Health Crisis Act from 35 million to 60 million next fiscal year, which I think is probably going to be warranted once that 988 goes into effect. As you know, we here in Orange County are really ready for 988. We have our 24/7 crisis call center. They're currently receiving lifeline calls, which will be the 988 calls. And they will be getting an additional stipend for those calls, which we're pleased about because, you know, the demand for the service in our crisis call center is very high, and additional funds may allow us to have additional staff and coverage of those calls.
Commissioner, just a quick question while we're on that. With a couple months back, we were discussing the 311 with some spotty areas in
Yes.
Newburgh, I think,
Yes.
and they were working with the folks over at the EMS and
Yes.
Brendan Casey's group. And
Yes.
how has that been progressing? Have they
It
found
gets-
a way to alleviate that, or?
It could still be a big spotty, especially in the Newburgh area, which it was all along, unfortunately. I believe, wasn't it you and I were going back and forth late night and you're going 311's not working? Right, and so, yeah,
It was during there was when we were doing the.
well, the point in time
point in
count,
time.
yes, that's right, it was point in time count.
You have a great memory.
Well, at the end of the day, we are now advertising both numbers, the
Okay.
311 and the 10-digit. We just want to make sure that no one falls through the cracks when they're
Yeah.
looking for help. So we were just advertising the 311, but we've added the 10-digit number just to be sure that people connect.
And it's still in work in progress to try to fix that, or are we waiting for a
Yes.
new system or
Well,
something?
when we go to 988 too, 988, we created our own 3-digit number because we didn't want people who were homeless and didn't know how to access services to have to try to remember a 10-digit number, or people with serious mental illness while in crisis. You know, that's why we created our own 3-digit number here with a lot of support from Brendan Casey and the staff in the county attorney's office and everyone who helped in the county executive's office. But now that 988 is coming forward and it is being marketed not just for suicide prevention as a lifeline was marketed, but really for the support of people who are struggling with mental health issues, may not be suicidal, but need assistance, their families, people with substance use disorder and their families, which our 311 call center answers calls for all 3 service areas. So people with intellectual disabilities and developmental disabilities, as well as mental health and substance use issues. So I feel like across the country, we're going to be in better shape with people being able to access care, and 988 calls are going to come right through to our call
And
center.
when will that start up?
July,
July, oh, you said that. Thank
I
you.
believe. Am I
Okay.
right? No, because I know medication assisted treatment in jails is July, I believe. I could be wrong, but I'll check that date. I think it's July. that
It's
988
not
goes
too
into
far
effect.
off.
Correct, yes.
Okay. Go ahead.
The extension of Kendra's Law did go through, and, you know, there was some controversy back and forth about change in language and practice that was going to, some people felt, be more restrictive of people with mental illness using that court-ordered treatment. I don't have all the details on that yet. Our Conference of Local Mental Hygiene Directors attorney is reviewing that language, and we do have a spring meeting coming up at the end of the week, so I should learn more about any changes that might be connected with that. But that is for people who have serious mental illness, who are not complying, and as a result are dangerous to themselves or others. And then just the extension of APG methodology, that's ambulatory patient group. So it has allowed for some
What was that
increase ambulatory
Oh,
patient group.
Yeah.
So it's your reimbursement rates for outpatient services used to be just a standard rate. Now it's based on intensity of service and resources needed. Fortunately, it has allowed for some increase in our clinical services, which is very important. As we all have discussed here, the cost of hiring staff to fill those positions is so much greater for all of us, for county as well as for our provider system. So the higher reimbursement helps. And then the Joseph P. Dwyer, we have had this contract for veteran peer services and supports for a number of years with support from the state, and Mental Health Association administers that program for us. I'll just rush through. I know you have an agenda, so let me move forward on some of these things. We did receive our money from Assemblywoman Gunther. We're very pleased to have that funding and to be moving forward. Had positive conversations with law enforcement. Need to continue to support the training with them and the collaboration. Oh, I meant to send you all the walk information for the Children's Mental Health Awareness. I just made a note here for myself, send that to you. So you know, May 7th, May is Mental Health Awareness Month. Children's Mental Health Awareness Week is including the week of the 7th, and there will be a walk that week. Acknowledge the Healing Community Study, we talked about that Columbia research study, specific around opioids, goal of reducing fatalities by 40%. And you'll be happy to know, looking at OD maps, so our commissioner of the health department is in the back of the room, so this is not, the figures that have been supported by a medical examiner's office, but just looking at the trend, we, from January through April of last year, there were 48 fatalities reported on OD map. This year, that same time frame, there are only 12. 12 loss of life, and very saddened by that. But we're very appreciative of a 75% reduction. Looks like it's trending in that direction. None of that confirmed until the medical examiner's office actually gives us figures to confirm those numbers. But we're glad to see that trend changing. We talked a lot about our pediatricians, child prescribers, the need for more access to care for children and youth. Good hospital conversations, also with our prescribing community. We're looking at some partnerships between some who have more prescribing ability and clinics who have more therapy ability, so that we're working together to meet needs. And that's a very positive move forward. We're also kicking off a 0 to 5 committee, acknowledging that prevention starts early, and bringing in, it looks like SAMHSA and Georgetown are going to provide us with a facilitator to do a strategic planning model, mapping across the county to see what services we have already in place. We know what they are, but we'll put them down on a piece of paper, just like we did with our opioid task force, and see where our gaps are, so that we can better meet the needs of our 0 to 5 population and their families. And then I also believe I told you I would send you social media. I know I sent them to you,
Yes.
Sharon, too, but I didn't send them to all of you. Did I? I didn't send them to them. I will do that.
If you can send them
Yeah.
to those to Doreen.
We'll do that. And that's it.
All right, any questions?
It's not necessarily about this, but it's your area. SATU, SATU, is that program still,
Yes.
special assistance trauma unit? Is that?
I'm just impressed that you could come with special assistance trauma unit, because it used to be a sex abuse treatment unit. And so I can't change my mind from that. So I thank you for giving me.
Am I right, or is it?
No, you are
Okay.
correct.
That's still in?
Yes, it is. Oh, I'm sorry. Yes, that is a program that's part of our multidisciplinary team. We were talking about the last meeting. There are 3 FTEs of clinicians that are support the Child Advocacy Center and the children who have been abused and their non-offending parents or family members. And believe me, we have more referrals than we can manage.
So is there any, do you know if there's anything, maybe for that, does Orange County, does our team help other counties that perhaps don't have that, or does every county have something like that?
As far as the Child Advocacy Center or team, I don't know, every county is unique in how they've established. I believe that we were one of the last counties to have a Child Advocacy Center, because we had a multidisciplinary team without walls.
Mhm.
So I believe that almost, if not every county across the state does have a team, or does have a Child Advocacy Center. Sullivan County, to my understanding, does not. We worked out a MOU with them. We're allowing them to use our Child Advocacy Center for some of their medical exams,
Okay.
but they would not use our resources. Although the state police supervisor that supports our team also supports the Sullivan County team. She's part-time with us and part-time with them.
Okay.
So,
Okay, thank you.
Commissioner, one other thing too with this big satellite $25,000 grant, is that, have you always had those available?
No,
Or is this new now?
that's new. And also, New York State Office of Mental Health has put out a RFP for schools to apply to increase their availability of mental health services and supports within the schools. So we're hopeful some of the schools have applied for that, and they can use us to be the clinical supporter there. So they can apply for money, we can apply for money. So every school district that we bring forward to have a satellite, we can apply for those $25,000 with startup funds.
Yeah.
For each of the schools. And we're still waiting for OMH to give us final approval on Monroe Woodbury.
But
Yeah.
so they're not open yet?
No,
No.
they're not open yet, but we're very pleased. They not only, I believe they've identified a doctor and a clinician that can work as part of the team. So they're really eager. And
You
they
mentioned that about
identified staff.
psychiatrists.
Yeah.
Yeah, great, all right, and then you've got more schools down the road.
Goshen, Cornwall,
like
yes, the
That's
list.
missing, reach out to you.
Not to my
What
knowledge.
was that, Ken?
Thank you, menacing, I was wondering if menacing could reach.
So,
All right, thank you.
No, they haven't.
all right, thank you very much. Is there any questions or comments from the committee? No, thank you, Commissioner Miller.
Thank you all.
Appreciate all your information and all
Thank
you
you.
do.
Thank you.
All right, next up, we have Dr. Arena Gilman, Commissioner of Health.
How you doing?
Good afternoon, Doctor.
Good afternoon, everyone.
How are you doing there?
Good, yeah.
Good. All right, first up, we have a request to accept funds from the New York State Department of Health for a Healthy Neighborhoods Program grant for a 5-year period and to appropriate year one funds in the amount of $275,000 for the period of April 1st, 2022 through March 31st, 2023 into the operating budget legislative request number 063. May I get a motion?
So moved.
Okay. Legislative total. So. Okay, Doctor.
Thank you very much, Mr. Chairman. As you mentioned, the award amount is in the amount of $275,000 for the time frame that you have mentioned. It is for predominantly our Healthy Neighborhoods Program, which is an outreach effort under our Community Health Outreach Division. I believe you have the breakdown of expenses. It's really for staffing, employee consultant chargebacks, office supplies, specialty materials, and general outreach under that Healthy Neighborhoods Program.
Okay, great. Yes,
Question, yeah,
legislative.
sponsor, please, Mr. Chairman.
Sure. Any other comments or questions? All right, all in favor, say aye. Aye. Any opposed? All right, passes unanimous. All right, Commissioner, you go into your department update, please.
Thank you very much, Mr. Chairman. This month, we saw a slight increase in number of calls coming into the department regarding COVID. With the increase in numbers that we are seeing globally, nationwide, as well as within the state. So have the calls, they have increased. As we move into spring, applications for seasonal operations with children's camps, pools, water parks have increased. Our wastewater COVID analysis project at our 6 different wastewater treatment plants in Orange County continues. The quantifiable results are showing an increase over the last month that are in correlation with the increase we have seen in residents in the county. We are seeing some small clusters throughout the county, typically in congregate settings such as nursing homes, other facilities that are congregate settings in nature. As far as the wastewater surveillance, the typical increased trends have been for Newburgh, for example, for the week of April 7th sampling, the increase was 21% in intensity over 2 weeks. For Harriman, for the week of April 7th, there has been a 40% increase in intensity over 2 weeks. For Warwick, there has been a noted 6%. Now, these carry over from sample to sample. They're not overall increase for the population served. That's why we're actually looking at the linear graph and the trends over time before actually issuing notifications and public health alerts. We have drafted the public health alert, but we're still watching the trends to see if they persist over time or if this is just kind of a short interval kind of data. For Goshen, there has been a 45% increase in intensity. Actually, I will mention Goshen has had the most persistent and the largest increase thus far that we have recorded. Port Jervis has experienced a 33% increase in intensity over those 2 weeks, and Middletown 16%. Again, this is from sample to sample, so that's why we are actually watching the overall trends on that. In terms of population served, just to give you an idea, because obviously these are municipal water sources, we're a predominantly well water county. So for Newburgh, that covers approximately 36,227 persons. For Harriman, 42,921 persons. Warwick, 6,729. Goshen, 6,369. Port Jervis, 8,568. And for Middletown, 27,434. That's really the serving population for that municipal treatment, yes.
Now, when you, are you tracking also, like when you have the numbers and the increase per municipality, per treatment plant? Are you also tracking it with any kind of numbers that you get from the municipality itself, or?
As far as case numbers,
Cases?
yes, so we're correlating that with the data on the cases as well. But keep in mind that we only have the provider testing that's reported to us. All other means of testing, home testing, other sources obviously are not reportable to us. But we are seeing similar trends in terms of increases, so they do correlate.
They do.
The population doesn't necessarily overlap neatly as far as data,
Yeah.
but overall trends, they tend to be in line. And typically wastewater surveillance gives us about a week to a week and a half lead time where we're seeing the increase in wastewater as far as viral burden and intensity about a week to a week and a half prior to individuals presenting symptoms and testing. So it gives us that lead time to notify municipalities and congregate settings, susceptible, vulnerable, medically fragile populations, so they can take protective measures if they need to. So it's a great tool to have as an early detection, early warning.
Sure. Legislator Lindblom, you had a question?
Yes. When you said the Newburgh, were you talking about the city or the town? I'm assuming that. But
So
I know.
for Newburgh, I believe it is the town. I'll definitely get back to you because we have to see where the actual municipal source is. I wouldn't hold me to that just as yet.
Because I also know that the town tends to have a lot more well than city. Newburgh would
So
have.
then it's the city, it's the reverse. I'll actually take a look. It's for the municipal, predominantly municipal water, so it's the city.
Okay, just wanted to make sure because obviously we want to have that conversation with my municipal leaders. So that they're
Yes,
aware.
and typically the notification would go out if that trend persists over time and is not just a point in time increase. We definitely notify municipalities right away so they're aware of it and they post it.
Is there a threshold that you hit before you do, or just the consistency of it?
It's really the persistence over time. There's really no threshold per se as far as quantifiable value, right, of viral load.
Duration?
It's about how sustained it is. For Goshen, it was a very high increase, but for a very short amount of time. So we're waiting to see if it persists in terms of cases. And we did have later about a week to a week and a half lag on the correlating findings for the cases also.
Thank you.
So obviously, as I mentioned, if the current trends persist, we do notify municipalities in vulnerable congregate settings in those areas, such as hospitals, schools, nursing homes, OPWDD, other congregate living facilities. And it's similar to the notifications that we've issued prior to the previous Omicron surge that served us fairly well because those organizations were able to take protective measures that they saw fit. And individuals also were able to make an informed decision as far as the acceptable level of risk to themselves, their family members, susceptible, vulnerable residents in their households. The department is holding COVID vaccinations as we're off ramping slightly from the pandemic response. In and of itself, the department is holding COVID vaccinations by appointment only in Newburgh and Middletown offices. However, vaccination is abundantly available right now as it stands throughout the county, obviously within medical provider settings, FQHCs and pharmacies. That information is available online where individuals are able to access a vaccination closer to them. Additionally, we're working with school districts that may be interested in having vaccination for their students. We've held a number of point of distribution within schools. And the nursing division continues to provide booster vaccinations to homebound residents when needed, and we are continuing with boosters for those populations as well. As far as the division in general, we are in the process of compiling the community health assessment, which guides our community health improvement plan, and this is completed over 3 years. It is a requirement by the New York State Department of Health. It is a collaboration between local hospitals, the health department, and a number of local community organizations. So not only are we asking residents to complete a number of surveys over the next few months to really gauge their input and synthesize that data to guide our community health improvement plan, but also that would identify the health priority selection process for both ourselves, our medical facilities locally, our FHCs and other organizations. That document will be completed by December 2022. The version of the prior document is available online. It's quite a voluminous assessment, as you may imagine. And in line with that community health assessment, we are conducting listening sessions to speak with residents to really engage the community on what public health is, what we do, because obviously COVID response is a small fraction of the total number of services that are provided by the health department. And it's really more of a listening session than anything else. We give a fairly brief overview of a number of services that are provided within the local health department, but also it's really to listen to the resident health concerns, health needs as is identified by those localities where we have these listening sessions. And it's a phenomenal opportunity for the health department to gather feedback, a lot of the feedback that we need for the community health assessment, but also to guide our programs. We've already held sessions in Fort Jervis and in Middletown. We've had quite successful sessions, I would say, quite a bit of feedback, even more than we anticipated, and quite a bit of it was actually positive and very welcoming, so I'm glad to report that. So we will continue with those sessions. We have 3 or 4 more already geared up for the next couple of weeks, but typically we keep the legislature abreast of what's going on as far as the schedule and if it's happening in your area. And absolutely. Yes, we typically send out the calendar as it's coming up.
I saw it.
Yes, with hope that, again, engaging local organizations, the leaders, local leaders, and definitely our residents, because we want to hear back from the residents. We have hired 8.
Hey, how's it going? Not much. They're running a little late.
Huh?
They're running a little late.
Late, 4:45.
The meeting before.
Oh.
We can hear you. So the department has hired 8, and it will be 9 by the end of April, public health fellows through the New York State Public Health Workforce Grant. The fellows are assisting with COVID activities, as I mentioned, data management analysis, a lot of the synthesis of the data for the community health assessment, the health education and data analysis for the sexually transmitted infections, and department-wide social media communications. We have 3 more individuals that will be joining us by the end of May, and that funding goes through July 2023. And I believe there are conversations currently for extensions for longer than that. So hopefully that will be the case. Overall, I will say, I'll leave the COVID report with just one brief mention of it, but the overall vaccination, I think I mentioned it last time, for vaccine preventable diseases, especially among the school-age children, are down, not just in Orange County, statewide, nationwide, obviously in light of the pandemic and after the pandemic. So we're still catching up. And I think I mentioned that last time that we are working with the New York State Department of Health and a lot of our local organizations and medical providers to really ensure that parents are taking their children to the pediatrician's office and catching up on any age-appropriate vaccination. Because with everything that is currently going on globally, but specifically in Eastern Europe, the conflict in the Ukraine, clearly there is a public health concern with Ukraine being at the epicenter of the measles outbreak for the past number of years. Their last reported annual number was 57,000 confirmed cases of measles. And that was a year and a half back. Their health ministry, Ukraine's health ministry, also reported a polio outbreak, quite a large polio outbreak, over 20 cases back in October. So we are seeing a resurgence of vaccine preventable diseases that are currently active. And clearly with not only refugees, but immigrants, visitors coming from that region to all areas, ours as well, there is that potential, especially with us having a densely populated area that's severely under-vaccinated for the school-age children population. We're sort of on a collision course to get back to the pre-pandemic measles outbreak potential. We've already experienced the measles outbreak locally. So in an effort to prevent that, we're working actively with the New York State Department of Health, not only to audit schools and ensure that there is vaccine compliance with the New York State law. And again, I'm speaking outside of COVID. This is for all vaccine preventable diseases, but really to ensure that providers are up to date and any assistance that we can offer from the health department perspective by providing vaccine clinics, point of distribution, anything we can do on our part to just expedite that vaccination process. We're there to do that as well, not just in an auditory capacity, but also to really provide that support and the services there. As far as the COVID report, you see the statistics in front of you. There is a sustained increase, but the only highlight is that the New York State Department of Health has expressed increased concern about the rising number of cases in specific regions across the state. They specifically mentioned central New York and surrounding areas at the time of that notification. That health alert was sent out to the general public, but I would, as I mentioned, we have drafted a health alert, but we're just standing by to see where we are with our wastewater surveillance testing and if that slight and
We're still
consistent
classified as low.
increase, yes, persists. We're not, by the CDC, we're no longer classified as low. We've reached medium at this point. But
You repeat that, where what?
medium level
Yeah.
of transmission, yeah. And our trends as far as wastewater, the latest trends are still showing an increase all across the board, except for Goshen. But the only reason, as I mentioned, Goshen having a slight decrease from last reading is because they've had a substantially high increase over the last 2 weeks. So there was a slight dip after that. But all of the other trends are showing a fairly sustainable increase over time. So that's where we are with COVID, and that's where we are kind of overall. Just a brief mention also, we will be submitting some research for publication as far as that novice strain of syphilis that was identified in Orange County. So on the STI, in the STI realm, we kind of have that atypical painful lesion presentation. So we're working with our medical community to change some of our protocols to reflect that and submit some of the research for publication also.
Any questions or comments? Commissioner? All right, thank you very much.
Thank you.
Okay,
Thank you. Stay well. Have a good one.
all right, next up, we have number 3, Lawrence Ledoux, Commissioner of Valley View Center, and Donna Strecker, Director of Finance.
Good afternoon.
Good afternoon. First up, we have requesting approval of 10% increase for all Valley View Certified Home Health Agency CHA consultants. This increase would be for occupational therapists, physical therapists, speech therapists, registered nurses, physical therapy assistants, and certified occupational therapy assistants. This increase will allow Valley View's rates to remain competitive among other CHAs in Orange County. This is legislative request number 069. Can I have a motion, please? Legislative Tortel. Sutherland. Okay.
So, yeah, we, first of all, there were a couple of good questions and some observations from yesterday's personnel committee meeting. So I think there was a sheet that was attached. There was a typo on this sheet. It should be just a 10% increase across the board for all these contractors that are listed on here. All these people are contractors. They're not Valley View employees. We only have 2 full-time Valley View employees for the CHA. We're asking for this because the deputy commissioner for the CHA came to me. She informed me that we did lose a physical therapy assistant to another agency because they were paying more, and subsequently she did a survey analysis. She talked to some people from Good Sam Home Healthcare and WellCare Home Healthcare, and she realized that the average rates for the majority of the rehab consultants for home healthcare are right around $90 an hour. So that's one of the reasons why our rates were slightly below that. So we wanted to increase our rates to remain competitive.
And what you corrected was where it was 80, you went up to 90, that should be 88.
Well, some of them had a more than 10% increase, and that was just an error. So all these should be 10% increases. So anything from 80 should be 88, anything from 90 should be 99. The 120 should be 132.
Okay. All right.
Also, there were some other additional questions. I'll put all this information in an email to all the legislators. So for 2021, we had a total of 1,716 therapy visits. The amount we paid out for therapy consultants in 2021 was $135,600. We serviced 107 patients in 2021 for the CHOP. The total number of PT visits for 2021 was 893. Total number of OT visits was 823. The average number of PT visits per patient is 8.3. The average of OT visits per patient is 7.6. So the average therapy cost per patient, that's for PT and OT services, is just under $1,300. It's $1,272. The average approximate reimbursement per patient is $4,500 per case. And then, did we pay any, there's a cancellation fee on here, and someone asked if we paid for any cancellation. We did not pay for any cancellation fees in 2021. Valley View did not pay for any cancellation fees. There were some cancellations, but our rehab vendor paid those cancellations.
Okay, great. It's, I know.
And like I said, I'll email all this information to you tomorrow.
To Gene or Doreen and.
Yep.
We'll get everybody up to date on that. Okay, does anybody have any further questions? I know it passed unanimously yesterday at CNC.
Yep, and they just were seeking the additional information. You'll have that tomorrow.
Okay, great. Any questions or comments? No, not seeing any. I'll call the question. All in favor? Aye. Any opposed? Motion carried. All right, up next is the monthly financials.
Good afternoon,
Donna?
everyone. The results we're reviewing today represent the first quarter performance for the facility. IGT, 2.1 million. I'm happy to report that is a larger payment in the first quarter than it was in the previous quarter. Previous year. Appropriated surplus that has not posted yet. We have no interest or government transfers. We do not have any emergency disaster fund in the first quarter, but Lawrence and I are happy to report the application that we made for phase 4 provider relief funding was approved. And you should see in the next month's financial $3.2 million. So we're really excited about that.
Good job.
We are.
We need it.
We do. Other revenues coming in, at 8.5 million. Certainly our financial outlook for the first quarter, where our revenues are being impacted by census and our inability to recruit staffing. Lawrence, how many units are closed right now?
About 70 beds right now.
70 beds.
The units that are closed are 70 beds worth,
It's like 2.5 units. Yep.
2.5.
and it equals 70 beds.
70 beds, yeah. Actually, 75 beds.
And we have 360 beds total.
Correct.
Correct.
Because you got two 60-bed units completely closed,
30
right?
bed, 230 beds and then
30
half of the
units and
rehab.
half of the rehab.
So basically, it looks like the census is down about, I'm sorry,
I'll go.
Go ahead.
it's down about 25%. And those units would basically account for all that if they were filled to 93 or so the way we used to.
Correct.
Is that
Pretty much.
correct?
That
Correct,
is
yes.
correct.
How many the full-time people we had working there, they're all still working with us, correct?
No, we lost a lot of people.
Well, I was gonna say,
Between retirements and people left
how
for
many?
COVID.
Do you know how many off the top of your head we had, say, at the end of 2019, right before the pandemic?
I'd have to go back and look.
Yeah,
That's a
we
good
have to
question.
look at that.
It was like 350 or something like that?
I mean, we always have around 350 budgeted positions. The budgeted
Yeah.
positions don't change. How many are filled?
Filled.
Is it 320 or so are filled most of the time?
I'd have to go back and
We
look. I
have to
can't
look.
answer the
How many do we have filled
2019.
right now?
I don't know that information.
We have to look at a vacancy
Get
report.
that
to tell
together.
you.
Yeah, we'll get
Send
it
that
for you.
along too for
Yeah.
us.
Yeah, we'll look at a vacancy report.
In other words, what I'm trying to figure out is these 2.5 units and 75 beds, how many of the people that used to be working there, X the ones that have departed because of the pandemic are still with us? And all of that would be basically overhead that isn't producing any revenue at this point. And,
Right.
Right.
but anyway, I'll let you come up.
I mean,
Yeah, yeah, yeah.
certainly on the personal service side, if you look at 2021 performance, you can see that, we came significantly under budget on our personal service expense, which is your payroll. And that is a component of having many vacant positions open throughout the year.
Because if I'm looking at how you're performing, we talked about this once before, I think you budgeted, 92 or 93% census for this year? And 90, and we're not gonna come anywhere near that, so
No.
we're,
We are not.
and other than the census, everything else is pretty much in line where it used to be. The thing that is really destroying us is the census.
Correct.
Yeah, the census.
And we don't see any way of changing them unless we're able to get people to open those units up.
Correct.
You said you had the demand to bring people in, you just don't have the people to work there.
Correct.
Correct.
Okay.
And that, Lawrence is going to speak about this, but I think it's probably a good segue, that there is minimum staffing requirements. So we're also, right, and so he'll speak to that, but we're looking at that as well. And what Lawrence and I have quickly realized that what a great strategy it was for him to deploy that and close down those units, because if you continue to fill those beds, we would not be able to meet the
We're-
mandated.
We're just meeting
We're
the
just
staffing
meeting it
requirements
right now.
now with our current census. Based on the number of employees we have,
Right.
but based on working hours.
But then every facility in New York State would be in the same position you are, just about.
Not if you're a for-profit facility and you continue to take new admissions and you haven't hired new staff. Not everybody's doing what we're doing, is my point.
I was saying that because everyone's having trouble bringing people in.
Sure.
Correct,
Sure.
right, that's correct, but not everybody's, I don't believe every facility has stopped taking admissions because they can't care for everybody.
Okay, thank you.
On the personal service side, we've expensed 4.559 million. Equipment, we've purchased about 524,000 so far. On the contractual side, we have 3.7 million earmarked for expenditure that we haven't actually expensed yet. And we actually spent about 1.698 already.
So the equipment is $524,500.
$524 so far, but the
Okay,
33 is
I thought you
earmarked.
said thousand.
I might have.
Oh, okay.
It's been a long day.
No, that's okay.
It's just been a tremendous day
I just
today.
I was ready to say that, I'm like, what's the big difference in what I have?
Yeah.
I just added a few more zeros
I
on
was gonna
there.
say you didn't get much.
And that's with my glasses.
So I guess you didn't get much equipment. 524.
Well, we have 33,000 ready there sitting for, we're waiting for the product to come in.
Good.
Okay. Okay, we did the contractual, the indirect cost doesn't post till year end. And on the benefit side, we're posted 4,757,000 in expense so far. And a small amount of serial bond interest, which is 17,157.
Any questions? Continue, please.
And the second page that you're looking at should be. You guys have this, you have this one that you're looking at? Yeah. Okay.
Yeah.
Thank you. This is kind of, this paints the picture for the first quarter where we stand as far as billable days in the nursing home and what our utilization is. So Our Medicaid population for the first quarter, we billed 83% of the revenue that we generated came from a Medicaid population, 1.9 also from Medicaid, but it was an HMO Medicaid, and Medicare 8.78, and our private pay at 5.48%. So 68.81 we averaged, that's our performance and census for the first quarter. Last year, same period, we were at 70.35.
Now with your, with the private pay, is, or the rates that we charge over there, they're set,
They
That's good.
increase every year.
they increase every year?
January.
Okay,
It's-
so, is there any kind of general percentage, or how do you come up with that, or?
I think you keep it universal, right? It's been a modest increase.
Yeah, I don't know. It hasn't been a lot, and
Yeah,
we're right in the middle of the pack in Orange County as far as private pay rates. We're not the highest, we're not the lowest, we're kind of right in the middle.
It's fine.
We've done a survey in the past of other facilities to see what their rates are.
Okay, thanks.
you're welcome. And if you turn to the last page, it's just giving you a picture of the census, same performance in March at 69.39%, and the average is 68.81. That's all I have.
All right, thank you, Tom.
You're welcome.
Any questions, comments? No, okay, we go on to the update.
So I hope everybody got a copy of this. I sent this out on Monday.
Yep.
So we, as Donna referenced the census, our census on April 18th was just over 68%. We still have two plus units closed. We are accepting short-term admissions, only up to 12 on one of our short-term rehab units. We did have 2 employees test positive for COVID over the weekend. We had 6 residents test positive last week. The New York State Department of Health has changed their protocols as far as how we're handling units when a resident does test positive. There are no units currently on precautions, and visitation is still allowed. Previously, when a resident tested positive on a unit, the Department of Health would put the unit on precautions and close the unit and not allow the residents to go out. But I think with all the vaccination status of our residents now and the science and things have changed, they're being a little bit more flexible with that, which is good. We are reviewing all residents that may be eligible for a second booster shot, and we'll be trying to work with the Orange County Department of Health to set up a pod for that. As Donna mentioned, we are getting just a little over 3.2 million in phase 4 of the Provider Relief Fund. The New York State minimum staffing law for nursing homes is now in effect. Donna has done some preliminary analysis, and we are just meeting the minimum requirements currently for the minimum staffing law. Leading Age New York is filing a lawsuit against the New York State Department of Health in an attempt to overturn this law. So I'll keep you posted on that. The Valley View CHA census is 12. We have 3 admissions scheduled for today. And the installation of the new call bell system in the Council building has been completed.
Very good.
Yep.
All right, any questions, comments? Legislator Nagustakis.
Thank you.
Hold on.
Quick question.
Yes.
Is the CHOP profitable at this point?
Not yet. I don't
Not
think.
yet.
Are you even or roughly?
I can report on that next month. I'll report on the numbers that we have for year end and the first quarter. I have to look at that. Remember that the CHA's operations didn't actually begin until March 8th, 2021 was
I
when we,
think, yeah.
that's when we took our first patient. So certainly the model that we developed, the financial model we developed was that Valley View would be a feeder source for the CHA.
Sure, absolutely.
So, now, fast forward the pandemic, lack of census. So we're now, scrambling to try to continue this service in the community. the deputy commissioner has a good rapport with other hospitals, and the referral she's been getting, because we haven't been able to bring anybody into rehab for quite a while. Our census is 12 right now. Before we were running 60 beds at about 87% occupancy, 85% occupancy. So a lot of those residents would go to the CHA. So this is another part of the operations that's being impacted by the lower census. So
Sure.
we can report on that.
But I guess the flip side of that, the good news is the hospitals know that the CHA is, and they are referring patients directly from the hospital to the CHA.
Yeah.
So it's kind of the other way around of how we anticipated it would happen. So we are getting the referrals.
From them.
So, right.
So if we can get back to some stability at some point, the CHA will be profitable.
Right.
It will definitely be profitable for us, and
Well, we knew that when we established it.
Yeah,
but
the
we didn't know
model-
the COVID situation
the model
was coming up.
works.
And just quickly on the census, our current census, you said is what, 68, 69?
Yeah,
Yeah, 68.3 as of Wednesday.
Yeah,
Or the other day.
which looks terrible, but if you think about it, if you factor out the 75 closed beds, and
yes,
then you do the calculation on what we have open, we got a
Right.
census up in the low 90s, 91%.
that
I
is
just did it
correct.
quickly off the
Quick
top of my
math,
head.
yes, you're right.
Which is outstanding. So it just points out again that our key problem here is getting people in to open up the other 75 beds to get us back to where we were before.
Correct.
the pandemic.
100%.
That is.
100%.
And again, we didn't have answers as to how we were gonna do that, did we?
Well, we did the referral bonus program and the sign-on
But we didn't
bonus
bring
program
anybody
has
in.
the point, the issue is the people aren't there for the healthcare system right now. We've gotten, I think there was the story in the paper this weekend, I've gotten 2 LPN resumes and 1 RN resume in 2 months from Indeed.
This could be outside your
So,
expertise,
right.
but is the education system taking advantage of the need, the community college system, trying to get people into that?
The problem is there was never enough new graduating LPNs and RNs before the pandemic to fill our needs. And now we had the pandemic, and now it's just made the problem even worse. And everybody's scrambling to try and hire those few people that are out there. So the state had an opportunity to address this in the budget. They could have allowed LPNs and RNs from other states to transfer the license over to New York, but they chose not to do that. I don't know why, in the state budget. So,
If I may, I also think it's very difficult, because you and I have had this conversation before, and I know just from working with potential students who want to go into nursing programs, they don't want to work with senior citizens.
Correct.
They don't want to work with the elderly. They want babies, they want emergency, they want, hey, it's very, very difficult, not just to get workers, but to get healthcare workers now, but to get them in your area.
we're not the sexy
You're not the
nursing.
cool- You're not the cool
yeah.
nurse if you're working,
Correct. Right.
It really has to be something that you want to do, that you have a population that you desire to work with.
Right. In the state budget, I'll forward the,
If New York State were to change that, you have a large amount of.
I don't know what the difference would be, but I guess the point I'm trying to make is they had an opportunity
Sure.
to open, the gates to more people, and they didn't do it.
Okay.
So I just received today the leading age executive budget recap. I'll send that out to everybody so you can read it for yourselves. There are some nice incentives in there. There's going to be some bonuses for workers, which is, direct care workers, which is good. And some other initiatives, but it's not enough.
Thank you.
Legislator O'Donnell?
Thank you. So this is on the minimum staffing.
Yes.
Was that based on the 68% census that you did that calculation? So if we had our expected 94, 95%, would we still meet the state standards?
No, we would be way below.
Way below the state
Right,
standards.
and that's the reason
So
why.
the calculations that you just presented were based on 68%.
Correct.
Based on filled beds.
That's the reason why we didn't.
We just barely
We
made
could
it
admit,
because we had
Right.
68%
Correct.
census. So if our
Correct.
census goes up, we're gonna be
Right.
way below
Correct.
legal minimum standard.
Right, and then you're talking about obviously care issues and
Right.
everything else. So,
Okay, thank you.
Yep.
Thank you, Chairman.
Yes, Ms. Legislator. Okay. If there's no other questions, comments, thank you very much.
Thank you,
Thank you.
appreciate it.
You appreciate the input always.
More info to follow. Check your emails tomorrow.
Okay, thank you.
Yep.
All right, item number 4, resolution of the Orange County Legislature recognizing National Skilled Nursing Care Week, May 8th through May 14th, 2022. Can I have a motion?
So moved.
Second.
Patel.
Chairman, if I
Yes.
may, I'd make a suggestion that we all sponsor this.
Yes,
Without-
okay. Doreen, can you make a note on that?
Absolutely.
And for the next one, Chairman.
And for the next one?
Yeah.
Good. All right, all in favor? Any opposed? Unanimous? All right, item number 5, resolution of the Orange County Legislature recognizing May 2022 as Lyme Disease Awareness Month. Can I get a motion, please?
So moved.
Second.
Okay, I have a.
Motion to adjourn?
Vote no. Can we have a vote on this? All in favor, say aye.
Aye.
Any opposed? No. Motion to adjourn.
So moved.
All in favor?